invite Dr. Rajendra Prasad, we all know is a terminal chopper man. He has developed many new instruments, many new devices. Let us see what he is going to tell us today.
Good afternoon, and thank you, Dr. Satanshu Mathur, for giving me opportunity to speak to the audience here. So, topic which I am going to talk about is sewing needle microcapsulotomy, and we do not have any financial interest. And you know that these intermittent pearly white cataracts, the main problem with these cases is creation of the capsulorhexis. And this is primarily because of most of these cases, they have a very hyperhydrated swollen lens. They have a multiple fluid pockets. There is a voluminous swollen nucleus, and anterior chamber is generally shallow. The anterior capsule is stretched out and thin, and it protruding towards anteriorly. So what happens, like when you puncture these capsule with the needle, you would get a complete volcanic eruption of the intralenticular fluid and escape of the pressure which is there inside the capsular bag. And this pressure which is released from the capsular bag, it produces a disruptive force on the edges where you have punctured it. So what happens many times when you puncture the capsule, because of these intralenticular pressure and the disruptive forces which is acting on the cut which you have made on the anterior capsule, starts extending to the periphery, and it results into a complete radial tear which is called as a Argentinian flag sign. Now this name was given by Daniel Perronet because this simulates exactly like a flag of the Argentina. So how to prevent it? You know that before we, and so how to prevent it? So before we do something, we should know that why the capsular tear extend to the periphery. So the postulations are like it is either because of the raised interlenticular pressure, and the second important factor which comes up is the forward thrust of the nucleus on the back of the anterior capsule. And this happens when you puncture the needle, puncture the capsule, or open up the capsule with the help of the forceps. And the third important factor which we have proposed is the configuration of the initial puncture, how you puncture the anterior capsule. And as you can see, like if you puncture the anterior capsule with the help of this needle, that is hypodermic needle, which has a tip which is like a knife, sharp tip, and you puncture, it creates a linear cut on the anterior capsule. Now this linear cut is also produced when we puncture with the help of the capsulorhexis forceps. So when you are using the capsulorhexis forceps on the anterior capsule, you try to puncture or penetrate it or create a tear. Now this tear, because here also you are creating a linear cut on the anterior capsule. Now this linear cut, once you produce with the puncture or with the help of the capsulorhexis forceps, as I said, there would be a certain upthrust of the nucleus. There would be a release of the interlenticular pressure and volcanic eruption of the fluid, which acts on this cut portion of the anterior capsule, and it starts extending to the periphery. So before starting capsulorhexis, many times we do the needle aspiration. This is the common technique which we have been using, and we have seen that many times we are successful, but quite some time the capsulorhexis tear extend to the periphery even after the needle aspiration. So we have several techniques. The technique which I am going to tell you here is again